A key stakeholder in healthcare marketing is the commercial insurance company. They make sure patients have access to care and pay the majority of healthcare costs. While the trend is to shift more and more costs to the patient, commercial insurance companies still pay for the lion's share of a person's healthcare. How do they do this? Where does the money come from and how do they organize? These are questions we'll answer in this section. It's important to understand the way insurance impacts patient and physician decisions because, as advertisers, we develop strategies and messages to get the patient to the physician and the physician to write the prescription. But what if everything falls apart after the prescription is written? What if the patient never gets the medication? Some clients may assume the marketing didn't work and turn to you for answers. Understanding the dynamic of commercial insurance companies can be an important key to helping ensure success of a campaign and diagnose challenges that might result from a marketing program if there's a failure to actually pull through on the advertising message. In this lesson, we'll develop an understanding of commercial insurance and its influence on a brand's marketing strategy. At the end of this section, you will be able to identify the major players in the commercial health insurance industry, understand the difference between self-funded and fully insured and why it matters for marketing, explain how HMOs and PPOs work, define how high-deductible health plans affect marketing strategy. Let's get started. There are three key stakeholders in healthcare: the patient who takes the medicine, the physician who prescribes the medicine, and the payer who pays for the physician's services and the patient's medication with the money the patient and their employer or the government has paid into the plan. Understanding these three and how they relate to each other is critical to understanding the commercial healthcare system. In commercial healthcare, these three stakeholders often have different names than they do in our work with pharma advertising. So the first step is to get everyone's name right. Patients are called members, physicians are providers, and payers are the insurers in the insurance world. The member, or the patient, selects a plan and pays a monthly premium for health care coverage to the insurer. The provider, or the physician, signs a contract with the insurer to provide care to their members according to a contract, sometimes a schedule of fees. Then the payer, or the insurance company, lists the provider on their network of providers so that members can select that physician. The member goes to the doctor for advice. The doctor does an exam, writes a prescription, and the member fills it at the pharmacy. The provider submits a claim to the insurer and gets paid according to the contracted fees. The member pays a smaller amount for their visit to the provider, often just a copay. The member or the patient also pays a small amount for their prescription. Again, a copay or coinsurance, depending on the type of prescription. The insurer pays the pharmacy the difference between the copay and the cost of the drug. Then the insurer pays the provider the difference between the copay and the agreed upon fees. Remember our first lesson where we talked about pooling? Well, the idea is that the insurer can't afford to pay for the entire care of a really sick member from just the small amount of premium they pay. The insurer thinks about the costs across a pool of people or a group of people. Because there are healthy people in the pool, the sick person can use more health care than others, and the healthy members in the pool will be paying into the pool to offset the costs. In terms of covered lives, United Healthcare is the leading insurer in the United States. Anthem, a Blue Cross Blue Shield plan, follows in second place and Aetna in third. Cigna and Humana are both smaller plans and targets for acquisition by the larger insurers, according to some recent information that's been published in the trade journals. Health insurers offer medical, pharmacy, and some dental coverage. Although usually dental coverage is offered through another insurer, Delta Dental is a leading network that offers their dental coverage to insurers. Health insurance companies manage the use of medical care through patient liability, physician oversight, and medical guidelines. Those are the step edits that require certain drugs to be used before others are prescribed. Now, the top insurers in the country offer members two kinds of plans. There's the PPO plan, or the Preferred Provider Organization, and the Health Management Organization, or HMO. These are vastly different types of access to healthcare and specialists. With more drugs coming to market requiring specialists to diagnose and treat, it's important to understand how the system of access to specialists work. PPOs are networks of physicians that have agreed to provide services to members of a health insurance plan for a set fee structure. The doctors charge discounted fees to the members, and patients pay copays and coinsurance when they use the services. Patients can see specialists if and when they wish. In an HMO plan, the physicians are contracted or hired into an organization that provides them a standard payment for each and every member. Not a fee that's assessed when the member seeks care, but a standard monthly payment for every member that is in their plan. Physicians in an HMO are therefore incentivized to keep members healthy and not using healthcare services. Because if they use the healthcare service, the physician has to pay for the difference if the monthly fee is more than what the physician needed to be reimbursed for. Patients pay a lower copay than they would if using a PPO. However, they cannot see a specialist when they wish. They have to have a referral from the primary care physician who will make sure that it's an appropriate thing for them to do and that it's something that's necessary that physician cannot provide. There's also a pharmacy benefit. In all types of health insurance plans, pharmacy or drug benefits are offered. They organize drugs into a formulary or a list of drugs that are covered by the health plan. They designate the drugs on the formulary into different tiers. Each tier carries a different level of payment by patients. Tier 1 drugs are usually generic drugs and available to patients for a low copay or a fee. Tier 2 drugs typically have a higher copay, and the top 3 or 4 tiers are the highest priced. Those tiers usually are branded drugs or newly approved drugs. When health plans want to restrict access to certain drugs, and one of the ways they do this is to list them on tiers 3 or 4. You will learn more about the ways health plans control access in drugs in the next lesson. High deductible health plans are those that have a higher deductible. And the deductible, remember, is the amount that the patient must pay before getting access to benefits like copays. Now, these plans can be HSA qualified or not. HSA stands for Health Savings Accounts, and to be qualified to open and contribute to a health savings account, you have to be covered by a certain type of medical plan, an HSA qualified plan. And that means your deductible has to be high enough to qualify you to these savings accounts where you can contribute pre-tax dollars that accumulate interest tax-free and can be used for health expenses. Now, as long as the funds are used for health expenses, they're not taxed. So the limit for a plan to be an HSA qualified is you must be paying at least $1,350 in a deductible per year for single members and $2,700 a year for family plans. Now, according to the CDC, the high deductible health plan membership is growing quickly. From 2007 to 2017, enrollment in high deductible health plans with a health savings account, so these are health savings account qualified plans, rose from 4.2% to 18.9%. Those without a health savings account rose from 10.6% enrolled to 24.5% enrollment. These increases were among adults aged 18 to 64 with employment-based coverage. Enrollment in traditional plans is decreasing. The National Health Insurance Survey reports that 43.2% of people under the age of 65 were covered by a high deductible health plan as of 2017. This percentage is expected to grow and will probably cover 50% of Americans under the age of 65 by this time next year. The growth of these plans will mean that affordability programs and patient support services that are offered by brands are going to be incredibly important. The annual reset of deductibles will also add a seasonality to many drug brand revenues. Considering these factors and messages when creating marketing strategies will become critical for the launch and growth of many brands. So this concludes our short chapter on commercial insurance. The way commercial insurance controls and manages healthcare for patients, as well as drug access, is critically important as we market new medications and treatments. As advertising representatives for your clients, your understanding of this system helps anticipate barriers to getting medications. You can use this knowledge to better position your brands with payers who are considering putting a new brand on formulary, and also with physicians and patients interested in treating conditions with your client's product. There are several readings and resources posted in this lesson about the insurance system. Feel free to read through these and learn more details about the leading insurance plans and how plan designs affect access to medications. In our next lesson, we'll discuss how plans use control of different medications or use controls to make sure that different medications are being used and to influence a patient's choice of the type of treatment and medication that they use.